Hi, welcome to this presentation about health literacy and why it is essential to teach health literacy within the health and physical education curriculum. First, what is health literacy and what are its origins? The notion of health literacy is still relatively new and misunderstood in education. The notion was conceived in the 1980s when health education was revolutionized, and health promotion was a crucial recommendation of the World Health Organization's Ottawa Charter for Health Promotion. This shift from a disease-centered approach moved to acknowledge that personal and social skills can guide health-related behaviors and decisions. It acknowledges that poor personal and social skills affect health-related decisions, and poor health literacy skills can be an indicator for poor health. Consequently, health literacy was devised to address these inadequacies and empower individuals to better control their own health outcomes. Nutbeam defined health literacy to be about how people understand information about health and healthcare, and how they apply that information to their lives and use it to make decisions and act on it. Various definitions of health literacy exist. In order to come to a consensus about these definitions, Sorensen and colleagues conducted a thorough study of 17 descriptions of health literacy and concluded that health literacy is linked to literacy and entails people's knowledge, motivation, and competencies to access, understand, appraise, and apply health information in order to make judgments and take decisions in everyday life concerning healthcare, disease prevention, and health promotion to maintain or improve quality of life during their life course. Building on this concept further, Nutbeam proposed a three-level hierarchy of health literacy. First is functional literacy. At this level, children use basic literacy skills to comprehend health-related information and function in day-to-day life and activities. For example, reading about nutrition, safety, and hygiene. The second level expands on the concept of interactive literacy. Interactive literacy refers to a more advanced cognitive and literacy skills which, together with social skills, can be used to actively participate in everyday activities to extract information and derive meaning from different forms of communication and apply new information to changing circumstances. For example, individuals developing specific skills such as problem solving, healthy food preparation, and developing good hygiene practices. The last level, the critical level of health literacy, refers to a more advanced cognitive skills which, together with social skills, can be applied to critically analyze information and to use this information to exert greater control over life events and situations. For example, classroom and community learning opportunities which address social inequities, determinants of health and policy development. Nutbeam argued that achieving the level of critical literacy allows for greater autonomy and personal empowerment. So why is health literacy so important to teach? Health literacy plays a part in the safety and quality of healthcare. Health literacy plays a part in the safety and quality of healthcare. It can influence decisions people make, such as how often to take medication, when to access healthcare services, and which services to access. Low individual health literacy can be associated with higher rates of hospitalization and emergency care use, sometimes indicating poor management of healthcare conditions outside the hospital system. Low levels of health literacy are also associated with lower participation in prevention programs, including influenza vaccinations, cervical and breast cancer screenings, and poor medication adherence. As the healthcare systems are becoming increasingly more complex, health literacy is becoming more important. The Victorian Curriculum and Assessment Authority demonstrate a firm belief in the concept of health literacy, and Nutbeam's model through its inclusion in the Health and Physical Education Program, or HPE curriculum. It is heavily referenced in the HPE rationale and aims, and also throughout the curriculum levels within various content descriptions. This is also reflected in the Australian curriculum, where it proposes to develop health literacy skills. This is mostly found in the personal, social, and community health strand of the HPE curriculum. There are numerous benefits for implementing health literacy in school-based health and physical education programs. The most obvious gains are for the students. Through health literacy education, students attain health knowledge that enables them to act in an informed manner to promote their health and the health of others. This process elicits greater control, which increases self-efficacy and a sense of empowerment in relation to health behaviours and decision making. It has also shown to provide opportunities for problem-solving, communication, and decision-making whilst improving literacy skills and compliance with medical care or advice. From a broader perspective, it encourages not only the student but the whole school to become informed and aware of the contributing social factors that influence health and promotes community action. Health literacy's inclusion in the national curriculum also offers a solution towards school-based HPE programs meeting the expectations of society. It allows schools to place common high-profile health-related issues on this education agenda and creates a learning space for critical dialogue regarding these matters. Furthermore, health literacy and education students can be better equipped with the necessary skills, understandings, and attitudes to potentially support them in the formation of future healthcare policies and practices. Health literacy research has voiced criticism towards schools failing to produce quality HPE programs and therefore not fulfilling their obligations regarding health promotion. Although there are numerous pros to implementing health literacy within the curriculum, there are also some cons. McQuaig and colleagues discussed this further and summarised the available evidence with reasons for this, including schools not viewing HPE as a high priority discipline, lack of resources, poorly trained staff, opposing priorities between health and education sectors, the disparities between policy and practice. He also states that school leaders are often ill-informed on the concept and the benefits of health literacy. Additionally, St. Ledger found that schools particularly failed to provide effective critical health literacy education. Reasons for this surrounded teacher knowledge and pedagogy, which can often be a determining factor regarding successful implementation of the relevant curriculum. However, the curriculum itself can be an area of concern, as it can be interpreted in a variety of ways and can be easily influenced by the educator's own knowledge and experiences. Renwick also highlights the effect of the generational gap between the teachers and students, and the effects this can have on teaching health literacy, as students and teachers may have competing views regarding what constitutes a health priority. With all these sub-strand evaluations, educators must ask what can be done to ensure better health literacy outcomes for young people. Please find the attached references and resources I have conducted in order to make my conclusions. It is evident from the literature that health literacy is an important social, economic, personal, and health development for students. The inclusion of health literacy in the national and Victorian curriculum highlights the dedication to building a greater health promotion capacity within schools. Schools should adopt evidence-based practices which promote a whole school approach, in addition to further development and training of in-service and pre-service teachers, as it is necessary for the successful implementation of health literacy in education within our schools. Thank you.